This procedure is a minimally invasive technique where we access the veins, often in the neck, the two largest veins in your neck on the side, and we put a cannula down into the clot and we essentially vacuum out the clot in the IVC, which is the largest vein in your abdomen, which drains all the blood from your legs and your pelvis. Once we unclog that vein, we then continue to remove the clot in the pelvis and then continue down in the legs until we've removed all the clot from the knees all the way to the heart. Most of the procedures are done with X-ray guidance, meaning it's much like a video game where we're watching the device on a screen as we're manipulating it with our hand, which goes through a very small incision in the vessel. So this is the angiovac aspiration catheter, and this is the device that we put in the neck that actually aspirates the clot from the veins. Although it's very large, the vein in the neck is about twice this size. So it's got an expandable tip that literally acts like a large cone on a vacuum that will reach down and remove the clot directly. It then extends through a filter, and then the blood is given back to the patient. So the procedure itself can take anywhere from about 2 hours to 3 hours. Most of that is preparation. The actual patient being under anesthesia is about half that time. Most of our patients have had incredible outcomes. We've had some patients that hadn't walked in 2 months and had been sitting in other hospitals on blood thinners, and 3 days after the procedure were doing physical therapy and have fully recovered.